Good afternoon. I want to thank the organizing committee to give me such a wonderful opportunity to tell a story about what had happened to healthcare in Malaysia and some of the challenges ahead. It is a story of remarkable progress in many areas we have achieved. It is a story of long-term commitment to improving health, and it is the story of a diverse health patterns and related health research directions to guide our future path. Now let me start with a question. Imagine this. You are the director of a large health institute and you are meeting with your fellow colleague to discuss health programs when suddenly your assistant bursts in and tell you the Ministry of Finance had just decided to provide your institution with $100 million funding for health research. But this funding can only be used for the most beneficial program. With other words, the most bang for the buck. So how do you use this money? For a small country like Malaysia, we are not blessed with a deep pocket. In fact, our government only spends a small portion of our annual GDP on healthcare. As you can see in the chart, in 2013, a total of only 4% GDP was spent on health-related activities, which include health research. When we look at other regional high-income countries, Malaysia is clearly spending less than our counterparts. In the same year, Japan has spent a total of 10.3% GDP on healthcare, while Korea and Taiwan spent 7.2 and 6.6% of their national GDP. Hong Kong, as a special administrative region of China, also spent a higher amount on healthcare than Malaysia at 5.2. Clearly, we need to prioritize how to spend our limited money and to achieve the maximum impact on health. Now let us look at the top 10 leading causes of disability adjusted life year, or DALIs, in Malaysia. At the very bottom of the chart, we have problems with intestinal nematodes infesting our people. The most common parasites are the helminths and the protozoans. These are most prevalent in the poor community, such as the Aborigine populations, squatter areas, and in poor Malay villages. The overall prevalence is between 40 to 58% in the early 2000s, but is rapidly decreasing. The clinical consequences of these infections are typically mild, but will impact the nutritional status of the infected, particularly children. At number 9, there are the skin diseases. Typically, these are previously thought of as small-time player in setting health priorities, but in the recent Global Burden of Disease study, clearly show that skin conditions are contributing to a much larger burden in both the developed and developing countries, particularly in tropical areas like Malaysia. The common skin diseases we encounter here include eczema, psoriasis, and acne vulgaris. Then we have the depressive disorder at number 8. It is the most common mental disorder in Malaysia. Although the estimated prevalence of the disorder is rather low, at approximately 1.8%, but unlike heart diseases or stroke, depression happens at a much earlier time, and therefore people carry the disability longer with them. At number 7, there is the chronic obstructive pulmonary diseases. Smoking is becoming more prevalent in the country. Our survey showed that COPD contributed to the majority of the health economic burdens among the tobacco-related diseases. On the other hand, lower back and neck pain cause more disability than other musculoskeletal problems such as osteoarthritis, which has grown a significant 25% since 1990. Now, I want to bring your attention to diabetes. This problem has the largest increase in the past 20 years, rising a terrible 60%. In 2013, 1 in 10 Malaysian is diabetic, and this figure did not take into consideration of gross underestimation. Diabetes is also estimated to contribute to around 3% deaths in the nation. We will analyze more of this trend later. And number 4 is the lower respiratory tract infections, which include tuberculosis. Malaysia is committed to reducing the number of TB cases in the country, and we will talk about that later as well. Number 3 is the cerebrovascular diseases, and this is the only condition which saw reduction in the past 20 years. The total reduction achieved is approximately 10%. And number 2 is road injuries, which has increased from third place in 1990 to 2013. And finally, the leading burden of disease goes to the ischemic heart disease. In the past 20 years, ischemic heart disease has risen tremendously, over 20%. When the country first obtained its independence in 1957, heart diseases were not even listed as one of the top 10 causes of death and disability. But throughout the years, it rose rapidly, and in 1980 became the leading cause of death in the country. This increase may partly due to improved methods of diagnosis and reporting, but we cannot ignore there is an actual increase in the occurrence of the disease as the society continues to improve its socio-economical status and changing lifestyle of the population. Together with cerebrovascular diseases, these two contributed to the majority of the cardiovascular burden of the country. As you can see, the chart pattern is very similar to most of the developed nations. Non-communicable diseases form a large part of the burden, while infectious diseases and injuries only account for a minor portion. To visualize the changes of burden of disease in Malaysia, the Institute of Health Metrics and Evaluation of the University of Washington has created a fascinating tool for this purpose. From this chart, blue represented non-communicable diseases, red infectious diseases, neonatal and nutritional problems, and greens are injuries. Now, if you look at Malaysia in 1990, a large portion is in red, where diarrhea, lower respiratory tract infections, and other common infectious diseases are prevalent. So is neonatal diseases here. HIV, TB, malaria, and other tropical diseases are shown in deep red, meaning they were increasing rapidly. Now let me change the year here and bring you forward to 2013. You can see red has decreased tremendously over the past 23 years, while blue rises to fill the gap. It is a typical trend where the country is becoming better and better in terms of socio-economical status. Less people are dying from diarrhea or malnutrition, and instead they died of cardiovascular diseases and cancer. Surely this is a public health success. Life expectancy has gone up and living becomes easier. In fact, NCD has become a global problem, and the United Nations has formally recognized NCD as a developmental challenge of epidemic proportion in its 66th General Assembly in 2011. During the summit, leaders from all over the world were urged to adopt targets to reduce heart diseases, cancer, lung diseases, and diabetes. As you can see from the previous slide, diabetes is a particular problem to Malaysia. More than 10% of our total population has diabetes, and from our local studies, we estimated roughly 25% of diabetic patients are undiagnosed. Let me show you the prevalence of diabetes in Malaysia and how we match up with the rest of the world. In this graph, the red line represents the percentage prevalence of diabetes in Malaysia across all ages in the x-axis. You can clearly see the number is much higher than the world's average throughout the whole graph. This is a major problem for us, and it is not hard to understand why when we cross-reference with a known risk factor of diabetes, that is obesity. Now sadly, we are also the fattest in the Southeast Asian region. The statistics show the number of overweight Malaysians are far more than our neighboring countries. This number stands at 43.8% for men and 48.6% for women. And the trend is increasing according to the WHO report. That is almost half of our population. As diabetes and obesity are also the risk factors for majority of other NCD, If we can control these two disorders, then we have hope to control other NCD too. Another issue that we face as a middle-income country is that there are increasing evidence to show not one, but double burden of disease. This is typically prevalent in low or middle-income country where the healthcare sector has to deal with rising burden from communicable diseases and NCDs, sometimes even from social behavioral illnesses. From the IHME chart I showed earlier, we can see Malaysia has successfully reduced the burden of infectious diseases, but problems with viruses and bacteria are still a challenge to our country. Let's zoom into the red quadrant here, and we will talk about TB, HIV, and dengue. We take a look at tuberculosis first. The latest WHO TB report released in late October show a general decreasing number of TB cases around the world, which is a good news for humanity. As part of the United Nations, Malaysia is also pushing forward to achieve the Millennium Development Goal to combat tuberculosis. Now let's look at how Malaysia is doing. In the x-axis is time from 1990 to 2013, and the y-axis is the number of TB cases per 100,000 populations. From the early 90s, Malaysia has recorded a much higher number of TB cases compared to the global statistics, and this number has gone down only for a little bit after almost 20 years. Out of 100,000 people, we have 250 TB cases compared to only 180 worldwide. But when we look at new TB cases per year, we know our effort is successful. Our average has decreased so much now, it is similar to the world's average. Now, if we compare to the rest of the Southeast Asian region, we are doing pretty well as well. However, our concern now shifts to the emergence of a multi-drug resistance of TB. Within a short 6 years' time, our MDR rate jumped from 0.3% to 1.3%, a four-fold increase. We should take note that all TB patients under the Malaysian Ministry of Healthcare receive DOTS, or direct observational therapy, but resistance rate is still continuing to climb. It is important for us to know what is the extent of MDR, its developmental pattern for Malaysia for us to better our chance in fighting it. The disease pattern changes when we talk about HIV. You see, this disease wasn't being reported in Malaysia before 1986. Since then, there has been a steep increase of new infections and deaths. Until 2013, there was a reported 101,000 confirmed HIV cases and more than 16,000 deaths. The disease prevalence followed a global trend, where it rose quite rapidly from the 1990s to 1997, and then it started to become plateaued due to various interventions. The number of cases became constant since. When we look at the incidence rate, you can see not much has changed. Now let me change this to death rate. You can see while the global death rate has decreased sharply throughout the years, our death rate plateaued. It is our priority now to first halt the spread of the disease and then to reduce the death rate. But there will be much more to be done and to be done quickly enough. Lastly, I want to talk about a new rising infectious disease in Malaysia, dengue. It is quickly becoming an epidemic in Malaysia. Here I have a very crude representations of dengue cases in 4 Southeast Asian countries in the year of 2014. The purpose of the chart is to showcase how fast dengue can become prevalent given the right condition. As you can see, we have 4 countries here: Cambodia, Malaysia, Philippines, and Singapore. On the x-axis is the number of cumulative cases. So when the bubbles travels from the left to the right, It shows the cases has gone up. On the y-axis is the cumulative number of dengue deaths. The higher the bubbles goes, the more people die. Please remember, this is a very crude representation to give you a general idea of the dengue epidemic in these countries. Now let me start this. In the beginning of the year, the dengue cases is still low, probably due to the dry season. Then in both Malaysia and the Philippines, the cases took on a rapid increases as compared to another two countries. Notice the death rate is linear against the number of cases. You can also notice the death rate in the Philippines increased at a much faster pace than Malaysia. At the end of 2014, Malaysia experienced a total of 93,000 cases with close to 200 dead. Judging from these numbers, we're expecting dengue to become more prevalent and deadly in the coming years. Our government is putting a lot of effort to curb the spread of the virus, but more research into the treatment, such as effective dengue vaccines, will be our priority. Reducing the burden of these major diseases cannot be done without the political and professional commitment. We need an international effort to bring about effective prevention and treatments and to deliver this to the populations. And I hope we can achieve much more together as members of the Reactor Forum than we can ever complete alone. I hope you enjoyed the presentations and have a good evening. Thank you.